Minister in the Presidency, Thembi Siweya, is today visiting vaccination sites in Polokwane in Limpopo. This comes as concerns are being raised over a possible third wave of COVID-19 infections in the country. So far, just over 180,000 healthcare workers have been inoculated. Ordinary South Africans are starting to wonder when they'll also get the jab. eNCA's reporter and my fellow anchor, Masigo is with officials in Polokwane, joining us now live this lunchtime. Masigo, I guess concerns on the ground must be there, but what are you finding out? What are you seeing? Or what is the sentiment in Polokwane?
Well, Bredan, it's not long since we arrived here at the St. Rita Hospital in the Sekhukhune municipality here in Limpopo. The Deputy Minister, as you've mentioned, she had started actually her first visit, I think, was in the northwest in terms of the Presidency's oversight visits on different parts of the country to find out how the vaccination rollout is going. She then went to the Eastern Cape, for instance, and of course today she is joining Poppy Ramatuba, the MEC of Health in this province, at this hospital to see how things are going there. But let's bring her in. The Deputy Minister is with us. Thank you very much for your time, Minister. You're live on eNCA. First of all, a lot of people would be saying that this isn't really a rollout because of the fact that we've been told by the Sisonke program, for instance, as well as the Health Department, which is in partnership with them, that this is actually a clinical trial of this vaccine that we currently have.
You'd remember that in one of the family meetings, as we call them as South Africans, the President mentioned the issue that we want to reach what you call a population immunity. And the rollout in itself, which is a rollout, by the way, is happening throughout the country. And as Presidency, we're traveling throughout the country with the Department of Planning, Monitoring and Evaluation to check how the rollout is going, because we want our people to be vaccinated. So it is a rollout. The other clinical aspect of it is not for me and yourself to be questioning. What South Africans need to know is that we're vaccinating our people. We've got a formula. We've started with our frontline workers, and from then we're going to other categories. And as the Presidency, through planning, monitoring and evaluation, we're going to provinces to go and check what are the challenges which they are facing, what are the recommendations which they can tell us as national, so that we can be able to advise the Interministerial Committee, which is chaired by the Deputy President, so that we can improve.
Minister, we've been speaking, for instance, to SAPRA and other organizations that are in partnership with government who are saying that this is actually a clinical trial. So we were thinking that maybe, in one of those family meetings that you mentioned, the President saying our first batch will really arrive in the second quarter. It seems that that was the actual truth, because AstraZeneca didn't work. This is being called a clinical trial, according to even government entities.
Yes, that clinical trial is a rollout of what we're giving our people as a vaccine. So it's a step towards ensuring that we reach that population immunity. So it's part of that process which the President has spoken about. And we want to appeal to our people that we must not get into the technical issues of the vaccine. Is it a technical, is it a trial, and so on. What South Africans need to know is that we are rolling out the vaccine and we're giving it to our people. We have started with our frontline workers. We go to provinces. Of course, each and every province will tell you about their own regional and provincial dynamics of giving it to our people. And therefore, we are here to collect the notes so that we can be able to improve.
I think the people are concerned because of hearing the word trial, and I think it is very important to explain to the public. But looking at this rollout, it's been quite slow now. It's stalling. What's happening?
No. It's going to come right. Look, this is a pandemic. We did not plan for it. What we are doing as government, especially in the Presidency led by the Deputy President on the Interministerial Committee, is that we are ensuring that we correct on our moves. For example, when we are here today, they are saying that the demand is high. they are requesting for the vaccine. And what we're going to do as planning, monitoring and evaluation is to take the concerns which they're giving us so that we can fast-track the process of ensuring that we get more vaccines and we give our people. Government remains committed to ensuring that we vaccinate our people. Of course, we are requesting that our people must bear with us because this is new for all of us, and we're trying to improve. In the process of improving, there's glitches and that. But South Africans need to have the confidence that we remain committed to ensuring that we vaccinate all of us. And when you talk about a clinical trial, and we want to dismiss this thing from our people, do not think about it. It was us, our government, when we received our first batches and the doses, we were the ones who said, these ones, depending on the variants, it is not correct for our people. It was us. And when Johnson & Johnson came into effect, it was still the same very government. And we do this, and our people must remain confident that whatever we are giving them, it is safe. The president has taken that vaccine, public servants are taking it, and there is no problem with it. And let's rub the other negative stories. We must focus as South Africans that we are giving our people the vaccine, but most importantly is that while you take the vaccine, you must still sanitize, social distance, mask, stay at home, regulations, they still remain intact.
The target was 1 million healthcare workers. The target was 1 million healthcare workers by the end of this month. It's been pushed by 2 weeks. We've only inoculated just under 100 and something thousand, about 190,000 healthcare workers. Do you really think adding 2 weeks will reach 1 million? Only 66,000 doses arrived this weekend.
Unfortunately, I can't be a prophet.
Okay. How much have we spent on the vaccine so far?
I can't tell you the numbers. I would necessarily be lying. But what I can commit to you is that the population immunity which we have planned as government, we are going to reach it. Of course, we want to apologize to our people. There's glitches in the process because we want everything to go correctly. But we are pushing so that we can save life and save livelihoods.
Thank you very much, Deputy Minister. Of course, we'll be going with you around the hospital to see how it's going here. But Dan, sorry for taking a bit of time there. Of course, there's a lot of questions of clarity around this vaccine that a lot of South Africans are asking themselves about.
Thank you very much, the Masiho Rashaha in Polokwane.